Hello everyone and welcome to NEET Mentor. In this video we are going to talk about the branch specifications, how to choose a branch and on which what are the different factors. And we are going to talk about all the clinical branches, mostly radiodiagnosis, what are the pros and cons in each and every branches, and depending on your experience and when you talk to your seniors you will get to know which is more suitable branch, because I have seen candidates are still confused in selecting the branches. So pediatrics, general surgery, dermatology, gynecology, orthopedics, ENT, ophthalmology, anesthesia, TB chest, psychiatry, radiotherapy, family medicine, emergency medicine, these all branches. Okay, so if you're new here, please do subscribe this channel, and you can also visit our Telegram group. You can join that, and you can join our WhatsApp groups also. Link is available in the description of the video. You can take our counseling guidance packages for government, DNB diploma, and for private and deemed. We have some discount offer going on, and for that you can call us on 9319128677. It will be applicable for few days. So the first step is which branch you are going to choose, because in case you select the branch which is more suitable, now suppose you are getting a branch in better college and you are getting other branches in a mediocre type of college. Okay, so branch is going to be with you for lifelong, and your lifestyle depends on the branch selection. So you have to be very specific and in selecting of branches and prioritizing it 1 2 3 4 like that. In case you select wrong branch and which is not suitable with your personal nature or personal interest, passion, then you might be repenting in the later part of your life. Okay, so having done a branch in like very good college, suppose you are able to get pathology in top medical college in Delhi. Okay, and you are able to get ophthalmology, okay, in some kind of like remote areas but in government college. Okay, so which is more preferred? So first you need to know, see, there is a sequence of like the branches which is more in demand. So first, right now we see radiodiagnosis is highest in the demand, then general medicine, and then dermatology. Then you have the demand for obs and gynae, then pediatrics, then orthopedics, respiratory medicine, then comes general surgery, then ophthalmology, psychiatry, ENT, anesthesia, and radiotherapy. So this is as per the current time, but in the later, after 5 years, 10 years, the demand might change. Some branches will have more saturation and some branches are already saturated. If you are taking some branches where there is a high chance for you doing super specialization, that might be saturated now. Okay, so you have to look at the branch from the perspective where your passion belongs to. Okay, which you like more, because you have to invest, you have to spend your like whole day with the same branch, and your lifestyle is going to change. It is going to impact your life. If you want like comfortable life, or you want like more money, you want yourself to be busy, you want more reputation in the social reputation, you want more name and fame, you want to set up your own hospital. Okay, so what you want, you don't want to set up your hospital, you want to do job, and you want kind of like very comfortable life. When you want to work, you work, and there's no compulsion, you want less emergencies. Okay, so these all inputs will play a big role in selection of the branches. Uh, let's start with radiodiagnosis. Is highest demanding branch now, and how you can figure out like which is in highest demand. Suppose somebody got rank just up to just qualifying. In order to get the particular branch in just qualifying score, take a radiodiagnosis. It will take like 60 to 70 lakhs per year. But when you go for ENT, it is also possible in 20 to 25 lakhs in just qualifying score. So see, the tuition fee is that high because the demand is high, the number of seat is also less. Okay, so depending on that, the tuition fee is high. When suppose just hypothetical scenario, suppose in some time a particular branch gets more demanded, okay, then radio diagnosis is less demanded, their cutoff will also reduce, okay, it won't be that high cutoff. So it all depends on the current time demand, but you have to think from your own perspective, like what you want. So the pros with radio diagnosis is you have good money immediately after completion of MD. Okay, in the remote areas, okay, you can earn more. You can have your diagnostic center and all. Less stress because you don't have so much of patient interaction, no patient interaction at all, and your work-life balance will be also maintained. And it's also kind of end branch. If you don't do any kind of super specialization, still there is a scope of super specialization, but still you don't do, there is no harm. And good reputation also. The negative side of it is social recognition will be less because you are not interacting with the patient, you are not solving their problems, you are just diagnosing at the back end side. Okay, the setup is more expensive now. Some of the things are happening through artificial intelligence, but in the longer run also it won't replace all the manual intervention. Require good infrastructure and no patient interaction. General medicine is ever demanding branch, okay, which has a lot of scope for super specialization, and without super specialization so there is a good demand. That's why in spite of having so many seats in particular every colleges, still the demand is high. It's evergreen branch, good reputation because most of the cases first will come to general medicine, and after diagnose they will refer it to other specifications and other department. Good amount of money, there is no end. You can earn like as much as you want, and it all depends on your skill and your hard work. uh, Good job opportunities, and it's also rewarding. The cons here is you need to go for a super specialization after certain years of experience. The workload will be more and more stress, the job is so challenging, but so much of money and reputation. Pediatrics, it is a kind of end branch, so relatively end branch and no setup. You don't have to invest much, you just can open your own clinic without so much of investment. It's also evergreen branch and the demand will be there, okay, because every person now is taking care extra care about their children during the age of up to 10 years, okay. Good opportunities, job opportunity and good money also, okay. If you have your setup in metro cities, it is more rewarding. Cons is like a workload and emergencies also, more effort you need to put for money. uh, Recognition is there but not as good as like general medicine doctors. And now competition is also increasing because this end branch, so after completion of MDMS they are directly going to the uh, their end branch. Next branch is general surgery, okay. It's also very much demanding after super specialization. The good part here is reputation is very good, okay. Top surgeons are known at worldwide level, okay. And it's also evergreen branch, there is no replacement. Job opportunities are good after super specialization, and good money also. Super specialization is required, that's MCH is required, and that's cons. And if you do just general surgery, there is a high competition and kind of saturation also as a, like general surgeon. The uh, risk filled cases will be more because where the chance of death and all, so there is more risk in treatment, and setup is also kind of like more expensive and difficult. Dermatology is also kind of evergreen branch, you have good money and no emergency cases. It's end branch, less stress and good reputation also you can get, okay. Regarding the dermatology branch, if you don't have your parental setup and all, so it takes like quite some time for you to get a reputation and you're getting set up in that society. Once it's done, then it's very easy after that, okay. So first 5 years 10 years will be little more effort, and then it will be very easy for you. Obscan is one of such branches where you have to put your high energy and you need to be energetic all the time. You need to handle a lot of emergency cases. The pros is a good amount of money. You can after just DG also you can have your own setup, and you can earn a lot. So first 10 years again you have to put hard work, then you can have your own setup, and you can direct others for the treatment and all, and you can have like a good life balance. Medicine plus surgery is so a mix of both. So whichever you like more, you can practice in that. The cause is high workload, emergencies, and more sensitive cases, but it's also rewarding, and you will have more satisfaction in the job because you get like recognized by the patient that comes to you, and they will have a long time relation with you, and they are like regular visitors to you. In orthopedics, that's kind of like getting more saturated, but still in demand this year, and is kind of end branch. Okay, so for those who do not want to study further, they can go for orthopedics in the surgical field. Good amount of money, and you can have your own setup and hospital, less emergencies, good reputation. Saturation, as mentioned, there is a little more saturation. The competition is also high, like pediatrics, and physically more demanding, so it's more suitable for men doctors, and for female it's less preferred. Okay, patient satisfaction is kind of there, but now there's some surgeries which is not that successful, so there the satisfaction doesn't come that much. Now coming to ENT, so those who do not want to have like didn't get good score or rank, they want to go for very comfortable branch, they can opt for ENT, and it's also kind of relatively end branch, less emergencies, minor surgeries. Okay, comfortable schedule, and you can also have money, not very good, but more than sufficient. Okay, and the stress is also less on as compared to like other emergency branches. You will have like a decent reputation, a rewarding branch, and money is also kind of on like average side, but that's depends on your future goal. Ophthalmology is also kind of in demand now, and is also kind of end branch. It has good money, but it takes like so much of amount initially to have the setup, and then you can get easy going, less emergencies, and stress free life will be there. Saturation is also kind of like problem which will come in the near future because corporates are entering at like big player in this ophthalmology, and it will be not that recognizing. Okay, but you can have like comfortable life and good amount of money, and the amount of money that you can earn by the years, it will increase depending on your setup. Anesthesia is kind of like having so many seats in different colleges, as number of seat means after medicine, anesthesia, and surgery, these three branches are having maximum number of seats. Okay, so the benefit here is just the day you get your degree, you will start earning. So initially your curve will be high. Okay, after few years you will get kind of like saturation or limitation in the growth, because you have to put your effort, and it will be based on like fixed or work. Okay, so you can join at multiple places, and you need to depend on others. Okay, for your whole life you can't have your own setup. Okay, money is decent in that, and scope will be there forever, wherever whenever there is a surgery, wherever it's required, anesthesiologists are required. Okay, so you need to handle with critical care, emergency cases, and recognition won't be that much. Okay, because they don't know you, because you are not interacting and directly diagnosing with a patient. Okay, growth is after like 10 years it will be limited. Respiratory medicine, many are talking about the respiratory medicine that it will be dissolved and under the general medicine, but still this branch is there, and its end branch, I personally believe that it's a good branch, because you have a lot of scope, and you put yourself in comfort zone depending on the lifestyle that you want, you can put yourself in that, and number of caseloads it will be also less, and it's emerging branch, job satisfaction is there, you can have your own setup also, and you can have job also. Recognition will be less, because you will get a particular limited patients, okay, and you can have decent amount, you can practice medicine in this. Psychiatry is also kind of like earlier it was more in demand, the demand reduced, now demand is increasing for psychiatry also. And it's also end branch which is very comfortable, okay, because you will have like patients who are coming and visiting to you for years, okay. So decent amount of money, more successful in the metro cities, and easy work life balance, good demand in metro cities. You need to have more patient interaction, and your patience level should be also high, otherwise you will get irritated with this kind of practice, okay. Difficult emergency cases, some emergency cases like in psychiatry, okay, you have to handle that situation. Sometimes it will be also boring and all. Radiotherapy is also kind of like emerging branch, but it doesn't have like full-fledged setup in many centers or hospitals, okay. So recognition won't be that much because you won't be known to the direct patients, okay. And some income capping will be also there, so there is a limitation in growth, okay. So you have more scope in research and all, and you are eligible for super specializations also. Some specific like cancer related treatment you will doing, so it will more satisfactory job for you. Family medicine is kind of like mixture of multiple branches where you do surgery and learn medicine also, and pediatrics as well. And this family medicine branch, government is promoting and having more seats in sponsored DNB. In diploma they have also family medicine, but there is no post PDCET secondary DNB in family medicine. After you complete diploma, you can't go for DNB. That's a problem if you go for diploma of family medicine, and you can have your own OPD and a decent amount of money. It's better than having MBBS. There is no super specialization, and difficult to survive in the metro cities, but in the government centers that they are opening hospitals in rural areas, there they are sending these family medicine doctors. Emergency medicine, as it suggests that, okay, is for emergency critical care set up in the hospitals, okay. So you have to deal with all emergencies. In emergency cases you have to deal with that. No OPD, okay. Job opportunities are good, okay. Saturation is not coming now, but it will come. In every branch saturation will come sooner or later, okay. Fixed hour duty, okay, you have to handle all the emergency cases, those thrilling kind of life. It's kind of backup branch of medicine. If you are very desperate to go for medicine, you can't go for surgery, then you can opt for emergency medicine. You can have decent amount of money, and the job opportunity is also good. So this all I wanted to discuss with you. Hope this video helped, and if it's helped, please share with others and do like it. Thanks for watching.